Well, hi everyone. This recording relates to the CARESTREAM course, HTHRHSC4191. If you're watching this recording, it's highly likely that you are enrolled in the course and that you're watching this as part of your orientation materials. My name is James Crick. Currently, I'm the director of the CARESTREAM student program, although there's always the possibility that this video exists longer, and I continue to have the great privilege of being significantly involved in the program. But the intent of this video is primarily to introduce important concepts related to the semester ahead so that you as the student have a much better idea of what exactly it is that you will be participating in. The hope is that this helps to clarify a lot of the specifics and particulars about participating in this course. Although if there are more questions, then we look forward to fielding those as well. So what is the CARESTREAM program? The CARESTREAM program originally was funded in order to allow students to have unique experiential learning opportunities while supporting healthcare operations. Several of the things that we know were that we have a strained healthcare workforce. We have tremendously talented clinicians, and yet it's not always the case where we have quite enough clinician availability to ensure optimal care for the patients within our health system. We also knew that within the College of Medicine generally, within the College of Arts and Sciences, and within certainly the College of Health and Rehabilitation Sciences, we have a talented and motivated student body, many of whom may be future healthcare professionals or who have aspirations to work in the medical field. And yet it's very difficult to gain direct experience to observe certain professions, whether that be physicians or nurses or some type of therapist or some type of case manager or social worker. And when we saw that, we said, is there an opportunity where we could potentially create a course whereby we combat some of the ills within our own healthcare system while also providing support to our workforce, reducing their burden, and also create a really exciting and dynamic learning experience for students. So we sought grant funding, and fortunately we were funded first in July of 2022 by a Care Innovation and Community Improvement Program grant. What we then designed as part of this portfolio of initiatives was the CARESTREAM student course. The general objectives of the broader CARESTREAM vision was to minimize immobility harms, reducing falls, frailty, and functional decline amongst patients within our healthcare system, and supporting discharge transitions while connecting patients and caregivers with local resources. So as we sought areas where students could optimally participate, we were looking at a variety of those, beginning in our emergency department, working through the hospital system and our inpatient units, working through our inpatient rehabilitation facility, and even exploring into some of our outpatient environments. I recorded this in July of 2024, so right at our 2-year mark since beginning this process. I'll tell you a little bit more about some of the results that we have in terms of student successes. But I want to take us back to when we were first considering this in the early part of 2022, as we were looking at a typical pathway of an individual patient working its way through our healthcare system. That initially they came in, they're working their way through this medical intake, and we can talk specifics about this, but really what I want to point out is there's a lot of waiting time. And because of this waiting time, these are opportunities where we sought to improve care and to enhance the patient experience. So our course objectives include creating opportunities for students to assist providing direct patient care while assisting the healthcare organization, so the medical center's efforts on fulfilling key performance metrics and enhancing patient satisfaction. We sought to optimize the efficiency and effectiveness of clinical operations by leveraging unskilled student assistants, allowing clinical staff to operate to the highest level of their capability and capacity. We continue to aim to integrate students into the patient care team, specifically to meet hospital safety goals, to facilitate idealized workflows, and again, to minimize the results, the negative results of being in the hospital and healthcare system, such as falls, frailty, and functional decline. And we always aim to participate in delivering direct supports to enhance the patient experience within our healthcare system. So let's talk a little bit about the specifics of the class now. So some of these things, most of these things, if you're watching this video and you're enrolled in the course, and this is either immediately prior to week 1 or this is week 1 of the course, then these should have been completed by now. And if they're not, you have probably heard from me or from one of the other course directors. So enrolled students in the CARESTREAM program, because of the legal contract of them being students entering into clinical settings where direct patient care is being provided, the students are required to provide documentation of their immunization history, a negative drug screen, a negative TB test. They have to complete a background check that is facilitated by the School of Health and Rehabilitation Sciences and is completed at the Ohio State University Wexner Medical Center ID processing according to the requirements to ultimately receive an ID badge, which will be required for students to wear anytime they're in clinical settings. And then they complete a clinical acknowledgement form that specifies that they understand that there is the risk that they will be exposed to patients who, of course, are sick. So as I said, if you haven't completed any of these, you should have already heard from somebody. But if you haven't, and you know that you haven't completed something, then please reach out to one of the course directors within the course syllabus. Now, importantly, Student Health Services handles all of the medical documentation compliance. If you have reached out to one of us asking a specific question, we have likely pointed you to the general email, which you see on the screen, for Student Health Services. So documentation specifics were emailed to you as far as what documentation is required and how to submit it so that you end up compliant to participate in the program. Specifically, documentation must be submitted to MyBuckMD and using the quote health professional student compliance document tag or via email. Now, it's really important to mention that submitting to the wrong email or using the wrong upload tag can create delays in processing. We have found that Student Health Services is tremendous in how much they stay up to date with each student individually, how responsive they are. So we're very thankful for their partnership. But if there are particular questions that you have about your specific situation, they will have to be fielded by Student Health Services. And finally, please note that failure to complete and submit all of the required documentation and to receive formal compliance, to be recognized as being formally compliant, if you are not recognized in that manner prior to the first day in clinic, you may not be able to begin in that clinical setting on that day. So the course is structured in a way where there are 2 credit hours of didactic coursework, just meaning that this is where you're going to be thinking and studying and learning and completing assignments. This is all asynchronous. So you'll be able to complete this on your own time. Typically, we open the modules 1 week at a time. So you'll have 1 week's worth of work that will open on late Sunday night into early Monday morning. And then assignments almost always are due by Sunday evening at 11:59 p.m. The experiential portion of this course, which is one of the big draws, of course, is 1 credit hour. Now, the total 3 credit hours are eligible for program and major elective credit. However, if you have specific questions about how this works towards your graduation goals, we encourage you to speak directly with your academic advisor. So the asynchronous coursework is focused particularly on the topic of what's called health system science, which, as you can read, is how healthcare is delivered to and received by patients and populations. So this includes things like how healthcare professionals work together to deliver care. Now, typically, we think of health system science as including primary domains of population and social determinants of health, health systems improvement, healthcare structures and processes, healthcare policy and economics, value in healthcare, informatics and health technology, amongst a handful of others. So what we believe typically are most commonly our students, not all, but most commonly our students are interested in becoming healthcare professionals. So moving into a graduate level clinical discipline. When you are in your clinical training, you will learn how to deliver care to individuals and to populations. Therefore, what we aim to provide is a critical gap oftentimes for students who are applying to these schools. And in our experience, our entire team is made up of physicians or therapists or nurses or case managers. What we tend to find is that students oftentimes have an improper perception of the American healthcare system, which of course is often changing as well. So the aim of the didactic portions of this course is to give a much more holistic understanding and viewpoint of the healthcare system and how care is received in our current environment. By university standards, 1 credit hour of experiential learning requires at least 45 hours of in-person participation over the course of a semester. Now, during the fall and the spring semesters, this equates to approximately 4 hours per week. We have developed our experiential learning opportunities in order to give exposure for students to grow professionally. Now, there are many different types of experiences that we have trialed over time. As you're watching this video, we are probably in consideration for many others as well. However, what we aim for is that students will be able to interact directly with healthcare professionals and with patients themselves, providing unskilled clinical participation. As part of this, you will be in active healthcare environments, and you'll be able to observe clinical professionals providing care. You may also provide support directly to those clinical professionals or to some others of our faculty and staff. We aim to give exposure to allow for navigation of career and job opportunities. And we also are always looking to support our existing hospital operations. And so as we're thinking about ways where students can be involved, those are kind of the parameters that we think about prior to specifically allowing students to participate in certain settings. So we're going to jump now into our syllabus. Now note that this is the syllabus for the autumn 2024 term. Your syllabus is available on Carmen, and it may have some differences from what you see on your screen in this recording. What I encourage you to do is to review your syllabus in depth, but we don't anticipate there to be substantial changes to the way that the course operates moving into the future. And if there are substantial changes, we will, of course, revisit this video. At the top, you can see here, it tells you a little bit about the course, as we already mentioned, who our current course coordinators are. It describes the class meeting schedule. This goes over just a little bit of what we just spoke about, specifically relating the fact that the class is asynchronous aside from your experiential learning observations. Now, an important point is that your experiential learning corresponds to the recitation section that you enrolled in. So if you enrolled in a recitation section that said Monday from 9 a.m. to 1 p.m., that will be your time in a clinical setting. We'll talk more about that later in this video. There'll be more information on Carmen. And there's also an in-person skills orientation where we will be able to review some of this as well. So as we scroll through here, there's some very important information that we will stop and touch on, but much of this is review of what we have just gone over within this video. Here's your course objectives, which are consistent with the course objectives that I mentioned earlier. You will, of course, require internet in order to participate in the asynchronous didactic portions. So much of the didactics is provided technically in this online distance learning format. There are some helpful links that are embedded within the syllabus. If you are having any difficulties with accessing the required platforms and utilizing the internet on campus or off campus effectively. Now, this course is in alignment with all existing university policies. We do highly encourage all students to pay close attention to your mental health and recognize the counseling and consultative services that are available to you as students. These are detailed here. An important point that any student who does require some degree of reasonable accommodations, you will need to register with Student Life Disability Services. That is something that we are well equipped to handle and manage based upon your unique needs, but it does need to go through the formal Student Life Disability Services process. As we get to our course assignments, these are fairly straightforward. Again, the specifics may change depending upon the time in which you're watching this video. So if you're watching this prior to the autumn 2024 course, this is your active syllabus. However, if you're watching this in the future, I again encourage you to look at your specific syllabus and to look for if there are any areas in which this is significantly different. So there is an interactive syllabus survey, very simple to complete, shouldn't take more than 5 or 10 minutes. It will click you through the specifics about your syllabus just to ensure that you have a good understanding of how this course runs and operates and that you've read the syllabus. We do have an in-person course orientation that is required. So we have created this video in order to reduce the time obligation for that. However, because you will be participating in specific patient care scenarios, we do have some specific skills that we will be training you in, which will take about an hour. The dates and the times will be particular to your semester. Typically, we offer multiple of these, and we try and provide them during off-peak class hours. You should have received an email from one of the course directors with these dates and times and asking you to reach out to us well in advance if you are unable to make one of these dates and times, and then we can work with you specifically. But again, our hope is that we can do these in batches so that you guys can all check together and begin to build class camaraderie. Each of you will develop personal learning objectives. These are really important items. You all come in with different beliefs about the health system, with different future career aspirations, and with different prior experiences. And because of that, we want to hear from you about specifically what it is that you are looking to get out of this course. These will serve as a guide for you to be forward thinking about what you get out of this course. And a framework is provided on Carmen. Now, each week as you participate in your experiential learning hours, you will need to keep track of your hours. We've provided a way to do this, including accessing an online submission form. So I'm going to click over to that quickly. This is the online submission form. Now, there are links for this on Carmen, which I will point out to you momentarily. And there's also links embedded within your syllabus. This is a very simple form that asks you to list your name. It will ask you to list your total number of experiential hours that you completed on that day. Again, depending on when you're watching this, you may have a 2-hour experiential learning block twice per week, or you may have a 4-hour experiential learning block once per week. But the aim is that you are keeping track of these numbers as the semester goes. So if we are ever audited as well, then we can attest to the fact that you did indeed complete those hours. What this data form also allows for is that you can complete specific site-specific data, so we understand exactly what it is that you are doing when you are at your experiential learning site. I won't click through all of these, but I will click through one just to show. So for example, in our hospital inpatient units, if that is where your experiential learning location is, and again, you will find out where you are placed as far as your experiential learning. That will be on Carmen the first week of classes. And we will be also talking about that in our in-person 1-hour skills orientation. So if you were in the hospital inpatient units and you've completed a shift, you will complete your name, you'll put in your hours, you'll click hospital inpatient units, and then you'll simply answer these questions. So at this time point on our inpatient units, we have students providing patient mobility support to patients. So you'll enter a number in here of the number of patient mobility support sessions. You might also be providing general support. So it could be any number of these types of items. You'll then fill that number in here. You may be doing some exercises with patients. You'll fill that in, and so on and so forth. And so as you go through, it should be fairly straightforward to click through all of these. It shouldn't take you more than a few minutes. And then you'll hit submit. What that does is that allows us to catalog overall the amount of tasks that are completed by our students during the semester while also keeping track of your hours. Now, it brings up an important point that I want to be very clear about. We have absolutely no productivity expectations. We don't expect you to see a certain number of patients. We are not holding you to some type of standard. We are not ever even looking at you as an individual, how many activities or tasks you completed. We do look at your individual hours completed, of course, but what we want to know is over the course of a semester, how many of each type of task were completed by our students, because we can then report that back to our clinical partners, and it helps us to further understand as we plan for the future what types of activities are successful or what other types of activities perhaps instead need to be revisited. So a very important thing to complete after every single one of your clinical encounters is going to be this data form. Going back to our syllabus, so you can see that you will keep track of your hours, and you will actually also submit the total of your hours 4 times during the semester. The reason for that is because we wanted to have 2 different kind of backups to ensure that we can attest for you that you completed all of the experiential learning hours by the end of the semester. And we give you points for these. So these are easy points. This is not going to take you more than just a few moments of keeping track of your hours over time, and I'll show you a good way to do that when we move over to the Carmen page. So there are particular Buckeye Learns that you're going to be required to complete. For this semester, there are 8 of these, so you're getting 40 easy points. These maybe aren't always the most interesting, but these are essential content for you to partake in. All healthcare personnel in the medical center are required to complete these and other Buckeye Learn modules every single year. So if you happen to be a medical center employee or volunteer and have completed these within the last year, then that's fine. You'll go on to Buckeye Learn. You'll find them in your transcript, but either way, you will be required to submit your certificate of completion in order to receive the points for this content. And importantly, you won't actually be able to participate in clinical settings until these are completed. You will be completing various reflections. This is really important as we are looking at, or as you are becoming a more informed future healthcare professional. We want you to be able to take the time and to receive course credit here for thinking about the experiences that you're undertaking. So you'll receive those. There are specifics for these, and all assignments are included in Carmen, which again, I will point out here momentarily when we flip over to the Carmen page. You will be participating in some discussion board debates. These are specific items or topical areas related to health system science that perhaps can be somewhat contentious or that don't have really clear answers. We aimed to put together some important food for thought journal articles to provide you with a little bit of background. So these assignments require you to take in and read some of these journal articles to become informed, and then to take a stance. And what we hope by you taking a stance and then providing your perspective and then commenting in a thoughtful manner and according to the guidelines that are on Carmen, that you're going to then delve deeper and have a deeper understanding of some of the difficulties that our current healthcare system faces. Indeed, there are not really easy answers for a lot of these debates. So you probably will find yourself feeling somewhat conflicted, and that's part of the point, is we want you to think deeply about it. Now, we have some other specific assignments related to various health system science topics that you can see here. They're each, again, worth about 20 points each for 80 total points. Pointing out once more that on Carmen, all of the assignments have particular instructions and grading rubrics, it should be fairly straightforward. I do want to point out that it is not our intent to make this an extremely burdensome didactic class. And in fact, a lot of the feedback that we've gotten from students are simply that they feel much more equipped to think about the healthcare environment in America, to compare that to perhaps other healthcare systems throughout the world. And now they feel like they're more informed as they then move towards considering something like a clinical or postgraduate career or degree. You have some specific quizzes based upon the didactic content. Much of our didactic content is aimed to be fairly easily digestible. So these are podcasts and YouTube videos and compelling articles and things of that nature, with the aim not being that you spend a ton of time on the taking in portion, but you do spend more time on the thinking and then providing some output. So these quizzes are not intended to be tricky or difficult. If you take in the course content, you're going to have no trouble with them. You have 3 attempts to achieve the highest score, and there's no time limit. So it should be fairly straightforward. Now, one of the kind of the flagships of this course is this final project. So you'll submit a proposal about 5 or 6 weeks before the end of the term in order to start to get you thinking about exactly what your topic will be. You'll choose a health system science topic, and then you will dive into a specific aspect of that topic, and you will present something such as a PowerPoint presentation or a poster or a blog post. And again, specific information is on Carmen. And then your final project will then be due on the final week of the course. A point about course schedule: we do aim to finish this course before, or right around the beginning of, or ideally before finals week. What that does is it gives you guys a little bit more of a runway to then focus in on finals without needing to go to your experiential learning sites. It doesn't always work perfectly that way based upon the requirement to get all of the course hours and just how the calendar happens to fall on a semester or yearly basis, but we do our best to do that. Specifics need to be found in your course schedule, which is located at the bottom of the syllabus. I will go over that for the autumn 2024 schedule momentarily. Now, our grading scale. In previous iterations, initially this was an S and a U class. So you either passed or you didn't pass. We moved towards a through F system, primarily to give credit to the tremendous work that you're doing and to ensure that we are upholding in our experiential learning times the ideal of clinical professionalism. So we will be holding you to a relatively high standard, but one that is not unfamiliar to a healthcare environment. So because patient care is being provided, for me as a clinician, if I show up late consistently, that has an impact then on my patients and on the other providers who are providing care during that time period. If I am sick and I don't call my manager or my supervisor in enough time, then it makes it really difficult to be able to have backups be called and in place prior to my shift beginning, which then has a negative impact on the patient care that is provided. So what we are aiming to do is to start to give you guys some exposure to that, to holding you to these standards that will be expected of you in a clinical career, and indeed in many professional ventures, even outside of healthcare, if that's where you end up in your career. So note that a significant amount of your grade is determined by your participation in tracking within your experiential learning times. So yes, there's a bunch of points up here, but for the most part, these are fairly easy points to acquire. It will be troublesome, unfortunately, if you are either not submitting assignments on time, not showing up to your experiential learning, being late to your experiential learning, or being improperly attired. We tried to be as explicit as we could in terms of the grading scale, which you see laid out here, as well as a penalty structure for consistent infraction. So you do get a warning for things like tardiness or improper attire. What you don't get a warning for is something like a no-call, no-show. So a no-call, no-show is a significant infraction in the healthcare world. And what that means is that if you have a clinical shift, in this case, your recitation time, that begins, let's say, at 9 a.m. on Monday, and it comes at 9 a.m. and you're not there, and 9:15 and you're not there, and 10 o'clock and you're not there. You have now no longer, and that's assumed that you haven't reached out to your preceptor or to your course director to let them know that you are sick or that there is traffic or something has happened. That is now a no-call, no-show, and there are significant penalties associated with that. That results in an immediate 10% grade reduction and a required meeting with the course director. In terms of tardiness or improperly attired, you can see that there is a specific grading scheme associated with that. Now, similarly, in this late assignment policy, you are required to get your 45 hours in. If you don't get 45 hours in by the end of the term, I want to be very clear, there is unfortunately nothing that we can do to then say that you can pass the course. We have put all of these checks in place to make sure that you know and that we know well ahead of time. So if you are, for some reason, you have a spell of illness or something comes up and you miss some of your experiential learning, you've called us, we all agree that it's an appropriate miss. There are more than ample opportunities for you to make up time. And indeed, we've had students who have just desired to gain more hours and they had some schedule flexibility and they've gained additional hours well above and beyond that 45. That's something that we can discuss as well. But we put a little bit of leniency in for late assignments, but you are required to complete all assignments. Now, as you are completing the data submission form each time, so at the end of your clinical shift, you will report the number of hours in your specific clinical data. We want you to do that. We want you to take the time to do that during your clinical shift. So at the end of your clinical shift, so you should always be planning to finish your clinical tasks, whatever that may look like, 10 to 15 minutes before, so that you have time to submit that before technically your shift ends. So for example, if you have a Monday at 9 a.m. to 1 p.m. shift, then beginning about 12:40, 12:45, you want to be starting to wind down your tasks, start counting up based upon your sheets. These are things we'll talk about in person, about your patient lists and things of that nature, how you keep track. And then you take that last 10 minutes or so to submit all of your course specific data so that before that 1 o'clock time frame shows up, you are finished, and that way you can then be ready to go. So I encourage you to look closely at this late assignment policy, at the tardiness policy, at the improper attire policy, in order to then ensure that you have a good understanding of it, because this is something that we do take seriously. So in terms of your attendance is required, of course, at your recitation sessions, which are your experiential learning times. Please note that for the autumn 2024 term, we have 2 of these in-person skills labs. So these simulation lab experiences, these occur in Atwell Hall typically, and they will be, these are updated obviously for each term. And so if you are watching this and your term is not autumn 2024, then please consult your syllabus, and you should have heard about this previously already. This just tells you a little bit again about your experiential learning expectations. And we also have these benchmarks. So you'll notice that in Carmen, which we'll go to shortly, that you have assignments for the Sunday after Friday, September 20th, by which time you should have acquired at least 10 hours. And by Friday, October 11th, you should have acquired at least 20 hours, and so on and so forth. What that does, you won't be penalized if you were ill and you only had 18 hours at this time. You still need to submit your assignment, but it just gives us all a flag to say, okay, we've got plenty of time left in the semester. Let's come up with a plan where you can make up these hours as needed. So these are your kind of benchmark points. But again, pointing out that if we don't meet that 45-hour threshold by the end of the term, that's when we have a big problem. Absences and makeup work will be provided on a case-by-case basis. You need to contact the course instructors well ahead of time. If you know that you are going to have an absence for whatever reason ahead of time, please communicate that to us. And then if you are ill on the morning of or the evening before, then it is your requirement to reach out to your course and your course preceptor. You'll know who that is based upon what I show you on Carmen here momentarily, but you'll have somebody specific to reach out to. So say, for example, you are in that Monday from 9 a.m. to 1 p.m. group, and it is Sunday evening and you are feverish and you feel terrible and you know that you are sick and you are not going to be able to make it in for that Monday morning shift, because we, of course, don't want to compromise the safety of our patients and we want you to get better, go ahead and email your course contact to let them know. That way we get those emails on Monday morning and we know that there will be some type of absence that we can communicate to our clinical partners. Now, say you're fine that Sunday evening, but you wake up Monday morning getting ready for the day and you are very, very sick. That does happen. We need you to reach out to us. At that point, we're going to ask you to, at the very least, send us a text message. So you will have all of our contact information. You'll reach out to your course contact. So again, we know, okay, you are ill. We hope that you get better. We're going to keep track of this, but we need to let our clinical partners know that instead of having their student or their students, we are down a student, or maybe they don't have any students at all that day. That way they can be prepared. Again, no shows is our big problem. We do want you to take good care of yourself. And so if you are experiencing illness, we just need you to communicate that to us. So the course schedule, this tells you again just a little bit about what's going on, what you are required to be at what sites and at what times. But that leads us into our course calendar. So this course calendar should reflect exactly with the Carmen course, with the dates and times that you see on Carmen. So working our way from left to right, this will tell you the week of the term. This tells you what date that Monday is that begins, what our topics are. This is the kind of the meat of the didactic portions that you will take in. And then here are a listing of the assignments that will be due by Sunday at 11:59 p.m. So you can see we go through, for example, your first couple weeks tend to be Buckeye Learns. You have some reflections due. Beginning in this case on week 3, we have immobility, harm, exercise, and mobilization in hospital settings. So you will take in these specific videos or podcasts, and then you will complete each of these assignments prior to Sunday at 11:59 p.m. There are typically as well important notices related to school closures and things like that. So for example, in this case, Monday, September 2nd is Labor Day. If it is a class holiday, then you will not have your experiential learning. So examples of that for this term include this Labor Day. We also have a fall break coming up here. So these are elucidated within the course schedule itself. But what's important to know as well is that, for example, if you are on the Tuesday, September 3rd, if your experiential learning time is Tuesdays, you will continue to meet as scheduled. So all of our the course assignments, this is really your one-stop shop to understand exactly where, when things are due, what your requirements are for that week. And again, this should mirror what is on Carmen very, very closely. Now, there's always the possibility in this or future semesters that the dates don't line up completely perfectly because one of our course directors or one of our education specialists just missed updating a date. Please just let us know. Mistakes do happen. Of course, if the mistake is our fault and that causes you or anybody else to be late on an assignment, we will for sure own that mistake, and you will have additional time to complete all assignments without penalty. But we do just ask that you let us know. And that brings us all the way into, you can see that we've identified our final experiential learning week. This is finals week this year. And so we will work our way through the last week of the term. So now moving over to our Carmen course, we'll move through this a little bit more quickly. So this is what the Carmen course for the most part should look like. Note that I'm not in student view, so you may see it may look just a little bit different on your view, but the content will be the same. You will be able to click here for course content, which will take you directly to modules. And then you will also be able to download your syllabus. Note that data form that we were accessing, here's a QR code. You'll have some QR codes at your experiential learning sites. You can complete that on your computer. You can use your iPhone or your Android phone, any type of smartphone. You can use your iPad. It's really entirely up to you, but you will need to complete that ideally prior to leaving your clinical experience. This is our planned team for the autumn 2024 semester. This individuals that you see here are certainly subject to change depending upon the term in which you're watching this. So really importantly, we will have course announcements that will come out. We will use this rather liberally, but I'm going to take us all the way down to modules. So your syllabus is available here, but in modules, this is really where we're gonna have a lot of information, and this is where you'll spend a good amount of your time. So start here is always a good place to start. This tells you again, here's your experiential hours tracker. So your hours and data submission, if you click this, it's a link to the forms that I had showed you earlier. Now there's also a hard copy for your hours tracker. Now, why do we have that? Because when you submit your hours on this data tracking form, that will send a catalog of it to us, but that doesn't provide it for you. And yet you will have 4 assignments during the term where you have to add up your hours and submit those. So don't just go back through and just count up the number of weeks, because if there was a holiday that you weren't in clinic, or if there was a day where you were ill, it becomes really difficult for you as individuals to keep close track of that. And so there is a hard copy here that you can either print out or save a copy of, and you just keep track of your hours that way. That's there. It's not required for you to use, but it's available to you. So your student clinical sites for the autumn 2024 term, I'm not going to open this, but this will open to an Excel sheet that tells you where your experiential learning location is. So you'll find your name, you'll figure out what the date is. It'll say the day and time. Again, the day and time will correspond to your recitation section, but identifying where your site is very important. This will be updated, of course, for future semesters as well. And then you can see here, I haven't updated yet our preceptor contact list. But if I open our preceptor contact list, then you can see from the spring 2024 term, it gives you the specific preceptors' names, their email addresses, and their phone numbers. And so you can then access these to be able to find out if how to communicate with your preceptor. Again, say you're running late for some reason, or you're ill and you needed to communicate with them directly via phone. There's also some resources here related to technical support in the Carmen Canvas guide. Close this. Now there are clinical site specific documents. You all will be in different clinical sites. So some of you may be, for example, in our inpatient units. Some of you may be affiliated with our case management team. Some of you may be at Dodd Rehabilitation Hospital. Your tasks will look different depending on which setting you're in. Now, we are not able to make changes to your clinical setting by the time that you're watching this video. And so if you do have a desire to observe another setting, then that's fine. You'll continue to be in your existing setting that's located like where I just showed you. But then after we start to get everybody oriented and competent within their specific clinical settings, then you'll have the opportunity to go and spend additional time observing other settings as well. But these clinical site specific documents, there's a lot here, but it's not required for all of you. So for example, if you are in the emergency department, then these will be very relevant for you to start to familiarize yourself with. And in fact, we want you, after reviewing this video and starting to familiarize yourself with Carmen, start to look over some of these. You're not going to have to be a perfect expert on them yet, but you will become very familiar with them. So if you're on the inpatient units, then these specific documents are going to be very important for you. If you're at Dodd Hall, and so on and so forth. So the clinical site specific documents just gives you more information about some of the things that you will need to know in order to participate in your clinical site. Now, one thing to point out as well, we'll give you a copy of these, but there will be a competency for each of our sites. What that means is that you will learn all of these things. You're going to go through your skills checklists, but actually physically on site, we need to make sure that you are competent to perform whatever the specific tasks are that we have for you. And so you will go through that specific competency. I won't open it because that will change semester over semester, and you can look at it in your own Carmen shell right now. But it will be something that you're required to be checked off on. Please direct any questions that you have to us in your clinical skills check time. So then we work our way down here. You can see that this week 1, August 19th through 25th, should mirror exactly what was on the bottom of the course syllabus in the course schedule. This takes you through all of your assignments. So for example, Student Health Services, Safety and Emergency Management, that's a Buckeye Learn course. So you'll open it, it'll tell you how to access the course in your Buckeye Learn. From your transcript, you can then save your certificate, and then you'll complete that assignment here. So your due dates are listed here, and then the number of points is listed following. And that should be the case with all of it. Same thing here as we move through clinical experiences begin. We put some information on here. So for example, if you're in the emergency department, this is where you will, put into your phone if you're unfamiliar with where that is. And then as of, again, this recording, all students in the ED and inpatient units, they actually meet together. Whereas if you're at Dodd Hall, you'll meet separately. And we'll give you more specifics about this during your in-person orientation skills checklist. But scrolling down through here, again, this should mirror very closely. It shouldn't leave anything up to the imagination. So you've got your topic, you've got the specific video links, and then you've got your quizzes, reflections, assignments, that sort of thing. So as we scroll all the way down here, these will all open on a week-over-week basis in order to give you that full week to complete the activities and to complete all of the didactic assignments. So that should pretty well take us through our Carmen course. Again, pointing out that everything that exists within Carmen here is also reflected within the course syllabus. We did our syllabus, we did our Carmen course review. Now, the logistics for your experiential learning activities. You will be given a red polo shirt. You received emails from us previously. These have to be ordered quite far in advance, believe it or not. But you are required to wear that red polo shirt for every single clinical encounter that you have. So if it's hot outside, it's a short sleeve shirt, you should be in good shape. Note that the medical center is, of course, kept relatively cool. And so if you do tend to be on the cool side, it is permissible for you to wear a long sleeve shirt underneath the red polo shirt. We ask that it not have, significant graphics on it or things like that, something that is subtle and discreet, but you can do that in order to keep warm. You are required to wear professional slacks, so they don't need to be anything incredibly dressy, but not sweatpants, not jeans, not shorts, and also not scrubs. So why not scrubs? That's not scrub bottoms. That's primarily because you will be interacting directly with the healthcare teams. You will be interacting directly with patients. There's always the possibility that one of your patients or one of the other patients nearby is having some type of a critical event. There should be no question in anybody's mind who is identifying who's around to help a patient if they can ask you, for example, to run and go get the crash cart. We don't expect you to always know perfectly where that is. Now, we would love for you to be available to help as needed. They should not mistake you for a clinician. That is required as part of our legal requirement that you will then not be wearing scrubs. So with your red polo shirt, with your professional slacks, you'll then wear closed-toed shoes. Note that athletic shoes are fine. Wear something that's comfortable. In basically every setting, you'll be up on your feet walking quite a bit. And then you need to have your ID badge on above your waist during your entire clinical shift. So your experiential learning times are listed on Carmen. We pointed that out previously. And this corresponds, of course, to your course recitation date and time. You'll be checking in with your on-site staff member before your shift begins. So again, pointing out that the language is extremely clear in the syllabus about we have the expectation that you are early or on time. So we ask that you give plenty of additional time to make sure that you are there early or on time. So we want to check in there before your shift begins. You'll know who the on-site staff member is because we'll tell you who that individual is at your at the clinical skills session on-site. So you will know that you need to reach out to a specific individual if you're running late on an occasion or if you're ill or something like that. But if you are showing up that day, you will then check in before your shift begins. And then, as we spoke about, you'll be completing a competency for your specific experiential learning location. We talked about this in depth already, the link for the experiential hours tracking and data submission. The only way that you can submit that is online. The link is available several places on the Carmen course site. It's also embedded within the syllabus. Must be completed the same day as your experiential learning. So again, spend the last 10 minutes of your experiential learning time completing. You will be keeping notes of your clinical day as you go so that it's really easy for you. So, 4 hours, you might be doing a lot of different things, and it becomes really easy to just tally those up if you've been keeping notes on your patient list as the day goes on. And again, pointing out, keeping track of and submitting your clinical hours. We've put in these kind of fail safes in multiple ways, but ultimately it's your responsibility. So if we can't prove and you can't justify that you have had those 45 hours, then we're in a problem if we were to get audited. And it's certainly a problem then because we have to attest that you have gotten those 45 hours in order to pass the course. We have never had that be a problem in the past because we put these fail safes in. So I think that, if you do have questions about it, we certainly want to answer those, but I don't suspect that that will be an issue for any of you moving forward. A couple of important items to point out just related to experiential learning, just to make sure that we're all on the same page. There will be some degree of downtime. So while there's lots of patients in the healthcare system, and we have lots of tasks for you to participate in, but there's also the reality that you all are not licensed. You're not clinicians. So there is a cap on the tasks that you can do. Further, you're not there all day every day. So at most, in our settings, we have students that are there for good portions of the day, Monday through Thursday or Monday through Friday, but we're not there in evenings and overnights, and students are not there on weekends and holidays. So we can't have you all doing tasks that are absolutely required to be provided to patients on, let's say, a 7-day per week basis. And so because of that, that does mean that there will be some degree of downtime. That said, when I say downtime, I just mean that you may not have a very particular task that you are actively engaged in at all times. We still believe that you're still going to be in that healthcare setting. You're still going to be in and around healthcare being delivered. And so there are always opportunities for you to spend time with observing patient care that's being delivered. So maybe that's you connect with a therapist and you say, hey, I'm a little bit shy on tasks right now. I've got a little bit of time. Is it okay if I observe or help you with something? Or you connect with a nurse, or you connect with a physician, or a group that's rounding to then try and just listen in and take in and learn from the care that's being provided. So when we say hands-on care, again, you are not clinicians, so we can't have you doing things that require specific clinical skills. You're not starting IVs, you're not drawing blood, you're not doing those specific skilled tasks. And so when we say hands-on, we do expect you to directly interact with healthcare professionals. We do expect you to directly interact with patients, but these are going to be hands-on activities in ways that are still unskilled. So we do focus significantly on health system science and quality focused experience. Now, this part is important, is that we put a lot of work into this class. We really, really want each of you to have an outstanding experience. As the semester goes and you become more and more familiar with your clinical setting and with the tasks that you're doing, if the experience is lacking and you feel like, for whatever reason, there's too much downtime, or you're getting pushback from the staff, or there's something that's going on to where you're saying this experience really just hasn't been that good, we want to know about it, because we can change things in the midst of the semester. Well, we won't be hip to hip with you the entire time. And so if you are just expecting us to know that, then that's impossible. And then we can't rectify the situation. So we have had times where we've had students ask us, specific things. They've identified tasks that they might be able to do to enhance their experience, and then have ended up with having a really tremendous experience. And so we do want you to reach out. We will not be able to identify you. You must identify yourself as just saying, hey, I think that this could be better. And then we can work together on how to make sure that that is indeed the case. So pointing out once more, our in-person skills lab, it's going to be primarily focused on things like safe patient handling. We're going to review some of the healthcare safety and hygiene principles. These dates were sent to you previously. They're on the syllabus. They're on Carmen. You should have let us know already if you can't attend one. We should have already figured out an alternative arrangement. If for some reason you're just now figuring that out, we need you to reach out to us immediately, because you are required to attend one of these in-person skill labs. Just pointing out, some of your week 1 and week 2 didactic focuses relate to things like hand hygiene. The most effective way for us to prevent the spread of infection within our healthcare system is to sanitize your hands. So you'll notice when you go into and begin to orient within your healthcare setting that there are hand sanitizer stations everywhere. So outside every single room, and directly inside most every single room, there's a place for you to sanitize your hands. There's also sinks that are widely available both in patient rooms as well as on the various units. So we do have the expectation that you are going to be sanitizing your hands before every patient interaction, as well as following every patient interaction. Now, say for some reason you're touching a patient in the midst, you're never wrong as well to take a pause even while you're working with that patient. Go ahead and sanitize your hands again. We will be maintaining at very least standard precautions for all patients. So this includes things like hand hygiene and making sure that they have their call button available, and ensuring that they have all of their needs met before you leave the room, and ensuring that we're maintaining a safe environment for care that's being provided. Depending on when you're watching this, and we'll be able to clarify any questions about this during your in-person skills orientation, masking is not required for all clinical encounters as of this recording. However, there's the possibility, if there's significant infectious spread within the community or within the health system, that may be instituted. You will be instructed on that, and masks will be available in the clinical setting. You will not have to bring one yourself. There are also additional precautions that are provided for some patients. You will still be able to interact with most of these patients. So, for example, if a patient has a particular type of infection that is difficult to treat with antibiotics, it's somewhat resistant, then we do take extra precautions to ensure that that is not spread to other patients. The most vulnerable people within our healthcare system are, of course, patients. And so you interacting with multiple patients, the last thing for you or any clinician that we want to do is to transmit an infection from one individual to another. So most of the additional precautions, such as gowning or wearing gloves or even additional eye protection or things like that, is to prevent the transmittance of disease, not only to you, but also even more pressingly to the other patients who you will see or interact with on that given day. Now, as far as situational awareness and conflict management, one of our primary aims is that you all are safe. We want all of the students to maintain safety the entire time. We have never, ever had an issue with violence related to a student from, a patient who perhaps is having some type of cognitive or psychiatric difficulty. But those types of patients do exist in our healthcare system. What we encourage you to think about is the fact that mental health care difficulties is just another type of illness. And so sometimes they require hospital level care as well. And we don't treat them any differently. We create a safe care environment for them. But because of psychological distress, emotional distress, mental unwell, their mental well-being not being quite as good as it should be or might be at another time, there is the possibility for conflict to arise. We never expect you to be in that situation. We have never had a student in that situation before, but maintaining situational awareness, so things like knowing, where you are within the hospital or within the unit or within the patient room, ensuring that you have access to a door. So, for example, if you're in a room, you're not allowing a patient who's becoming increasingly agitated to come between you and a door. You're spending time to talk to people and try and solve their problems rather than creating them. And again, some of this is covered in your Buckeye Learns, but the biggest thing that we want to impress upon each of you is the fact that you have our full and unwavering support to excuse yourself from any situation that you find threatening. So whether that's physical abuse, verbal abuse, anything of that nature, we ask ideally that the patient is placed into as safe a position as you can, or that you have some type of handoff, but you do not need to maintain in that situation. The clinicians who are there are required to help to desensitize that situation. We have security teams that are present 24/7. We have behavioral response teams that are available. It is not your job or your responsibility to take that on. We want you to maintain safety. You will never be questioned if you say that you are not going to fulfill some type of task because you were concerned for your own safety. We will support you in that wholeheartedly every time. If that situation ever were to arise, we do ask that you reach out to us to let us know. That way we can make sure that we loop back in with our clinical partners. We ensure that nothing gets lost in translation so that everybody remains on the same page and so that we can kind of go to bat for you all. So just a couple of quick slides here, just pointing out some of the tasks that we've had students completing. So this is just 2 semesters worth here of looking at almost 400 patients who were mobilized by our students, 240 patient support interactions. This might be things like playing games with patients, or getting them crossword puzzles, or even taking them outside. You can imagine that many of our patients, especially the ones, sometimes we have patients that are in the hospital for days, weeks, or even months, and they very rarely have the opportunity to go outside. And so if we do have the time for that, and the nurse's approval, then that's something that we for sure want to try and do as well. So again, looking, we have 461 social determinant of health screenings that have been completed. We have greater than 2,000 patient interactions at Dodd Hall, including almost 50 or a little bit more than 1,500 patient transports. So what we found is that this program is highly satisfying for our clinician audience. Really, really positive remarks. Nobody's indicating concerns. We've got a really great relationship with our clinicians. We also find generally that we have really high student satisfaction. We are finding that students become much more confident communicating with clinical staff. They've become much more confident communicating with patients. They find that their own professional self-efficacy grows during their time in the program, and also that they find particular niches of the healthcare environment that they weren't aware of before that are either really interesting, or conversely, that they find that perhaps that's not an area that they want to pursue. So now we did it. You made your way all the way through your first experiential learning hour. So you get to count this as an experiential learning hour. So you've only got 44 left in the term. You do not need to submit this hour using that link. You will submit just the times when you actually physically go into the clinic, but this does count. Now, you do have some homework. So in addition to the things on Carmen, the Buckeye Learns and things of that nature, what I do want you to do is I want you to spend some time practicing introducing yourself as if you're introducing yourself to a patient or a family member or a staff member. When I'm in clinical care, I go and I meet dozens of people every day that I have never met before. This might be other clinicians, or this might be patients themselves or patients' families or things like that. And so when I'm introducing myself, I want to make sure that I tell them who I am, what I am there for, and then what my ask is of them. So you will be doing the same thing. It's going to feel really awkward as you first, stand in front of a mirror and practice doing this. But I promise you, it's going to feel even more awkward the first time you walk into a hospitalized patient's room or a rehabilitative patient's room or a patient's room in the emergency department and you introduce yourself. So I really, really encourage you to spend some time practicing this introduction. What does that introduction look like? We want you to tell them that you're a student. So you might say that you're going to tell them that you're a student, then you're going to tell them what you're there for. So for example, if I'm there to offer some inpatient mobilization assistance with the patient, then what I am likely to do is to then come to introduce myself. So I may come and I knock and I say, "Hi, my name is James. I'm a CARESTREAM student. I'm an undergraduate student here at the university. And what I do is I help to facilitate people maintaining their strength and capability while they're in the hospital. How are you today?" So now what I've done is I've introduced myself. I've told them who I am so that they know that maybe I'm not the surgeon that they're waiting for, or I'm not the nurse that they had called for. And then I tell them a little bit about why I'm there. So you know what? I help to promote activity amongst patients to keep your strength. And then maybe I'm asking them just how they are. I'm trying to get to know them a little bit. Or maybe I'm asking them or describing to them how important it is that they maintain their physical strength and capability. And I invite them to come and to get on their feet and actually move around. So what I want you to do, the specifics you may not know right now, but what you can practice is the knocking on the door, introducing yourself. My name is James. I'm one of the CareStream students here. I'm an undergraduate student contributing to help ensure that your stay here in the hospital is as good as it can be. Or I'm here to help to complete a screening to where we can connect you to resources that are available to you because we want you to have the best care possible. So you're going to practice some of those things. Practice, getting used to it now. You're a health sciences intern, and then you'll have the specifics based upon where you're located for your experiential learning. If you have questions, again, we are the primary course directors here now. You will have received communication if this ever changes in the future, and you'll have different emails to reach out to. But we do want to answer any of your questions, and we look forward to a really successful semester together, and really look forward to getting to know each of you.